Yellow fever is a severe viral infection transmitted by infected mosquitoes, primarily found in parts of Africa and South America. Those affected may experience symptoms that range from mild fever and headache to more serious conditions like jaundice, which gives the disease its name, as the skin and eyes take on a yellowish tinge. For some, symptoms can progress to bleeding, organ failure, and sometimes death, particularly in severe cases where the disease enters a toxic phase. While there is no specific treatment for yellow fever, supportive care in hospitals and a safe and effective vaccine provide protection and can reduce the risk of fatality. People living in or traveling to endemic areas are at a higher risk, and vaccination is recommended as a crucial preventive measure for these individuals. Here's a detailed look at the various aspects of yellow fever, from its transmission to its global impact. Symptoms and progression of yellow fever. Yellow fever, a mosquito-borne viral disease, is a prime example of a zoonosis where wild animals act as reservoirs. The infection often starts with the sudden onset of fever and chills, followed by severe headache, back pain, general body aches, nausea, and vomiting. As the disease progresses, it can lead to a brief remission, followed by a more toxic phase, which involves jaundice, hence the name yellow fever, internal bleeding, and eventually multi-organ failure. This phase is characterized by the appearance of coffee ground vomit due to blood in the stomach. Without prompt treatment, yellow fever has a high mortality rate. Effective vaccination has made monumental strides in controlling outbreaks, yet it remains a disease of significant public health concern in tropical areas of Africa and South America. Diagnosis of yellow fever. The diagnosis of yellow fever, a viral hemorrhagic disease transmitted by infected mosquitoes, hinges on recognizing its symptoms and epidemiological factors. Initial symptoms often resemble those of other illnesses, such as fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue, which makes early clinical diagnosis challenging. Confirmation is usually achieved through laboratory tests, including serology, to detect antibodies or PCR to identify the viral RNA. Given that it is endemic in tropical areas of Africa and South America, travel history to these regions is crucial for raising suspicion. Rapid and accurate diagnosis is essential to implement timely treatment and public health measures to prevent outbreaks and ensure vaccination in at-risk areas. Cause and risk factor of yellow fever. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes, notably the Aedes and Haemococcus species. The virus is an arbovirus of the Flavivirus genus, which also includes dengue and Zika viruses. Its presence largely in tropical regions is due to the habitat of the mosquito vectors. Key risk factors include lack of vaccination and exposure in endemic areas such as sub-Saharan Africa and tropical South America. The risk escalates during the rainy season when mosquito populations increase. Forest workers, travelers, and individuals living in areas with poor mosquito control are at higher risk, with urban outbreaks being particularly dangerous due to dense populations and the efficiency of urban mosquito transmission. Treatment and management of yellow fever. Yellow fever, a mosquito-borne viral disease, presents challenges in treatment, primarily because there's no specific antiviral therapy currently available. Management is symptomatic, focusing on hydration, pain relief, fever reduction, and close observation for signs of complications like jaundice and hemorrhage. Prevention is pivotal, with WHO-recommended vaccines providing effective immunity. In outbreak settings, aggressive vector control and mass immunization are crucial. Researchers are exploring antiviral drugs that could tackle the virus directly, but until then, the emphasis is on preventing mosquito bites in at-risk regions through protective clothing, insect repellents, and community-level efforts to eliminate breeding grounds. Vaccination remains the cornerstone in the prevention and containment of yellow fever outbreaks.